TV is your home for Calgary's live civic election coverage. Join Shaw TV Channel 10 October 21st for the Countdown Show beginning at 7:30 and live commercial-free coverage beginning at 8 p.m. Live coverage, live results, live reactions. Election 2013, as it happens. October 21st, airing on Shaw TV Channel 10. Your voice in the community.
Hello animal lovers and welcome to the program. I'm Pet Guy Robert Church, and today we've got an important show for you because we're going to be talking about pet first aid. We want to help you deal with any kind of animal emergency that you come across, and we're going to do that by talking with Krista DeCarl, who is our guest today, and she is a certified first aid instructor with Walks and Wags Pet First Aid, and she is also the owner of a company called Royal Pooch Pet Services here in the northwest part of Calgary. Today we're going to be talking about some of the things you can do to help an animal in distress and recognize the symptoms of an animal in distress. And we're going to be talking about the Pet First Aid program that is offered and taught by Krista, who is our certified instructor, through the Walks and Wags Pet First Aid program. Great information and a really, really interesting program. I was looking at it online and I thought, wow, you know what? I think a lot of people could really benefit by that, by this type of a program. So Krista, welcome to the program. Thank you so much.
Thank you so much for having me. I appreciate it.
So funny. I'm online. I'm looking for a pet first aid person. I find Krista. I say, oh, can you come down? We're in the Shaw building and in Barlow and 32nd. And she goes, oh, I just worked down the hall. I'm right in the building. I've been working for Shaw for years. So it was awesome. What a funny coincidence.
Perfect.
And she was walking back in, and their boss was saying, why did you bring your dog to work?
Exactly.
So great. Thank you so much for being here. And just such a funny coincidence that you work in the building. Pet First Aid,
yes.
After your job here, is certainly your first love, isn't it?
Definitely, definitely. Animals have always been an important part of my life, and now going into the Pet First Aid side of it, I can actually pay them back to if there's an emergency.
So why did you get into why did you get into that?
Originally, I started it because like I said, I loved animals, but I started my Royal Pooch business, and I was dog walking, I was doing in-home boarding, and a lot of times when you'd go to the dog park, if there was any incident, you would see the crowd of people come around, stand there, start to scream, and not know what to do. And I started investigating. There had to be a way to actually be able to help these guys out, and I came across the Walks and Wags Pet First Aid.
Mm-hmm. Ethne Dickinson used to be with Oakland.
Oakland Educational Services.
And I did some work with her back when we were filming the Pet Guys and things like that, and I've had her on when I was doing radio, and so now you've taken over.
She's fantastic. Ethne actually decided to move on in 2007, and Lisa Wagner, who owns Walks and Wags, she was the one that stepped forward. She was an instructor in Vancouver. Took it all to Vancouver and actually outsourced it. So instructors go all the way across Canada, from Western Canada all the way to Eastern Canada and down to the States now as well.
Well, and what an important program, because like you said, people stand around, and that is so me. I would be the guy, hey, what do we do?
Yep.
And so fantastic that we can know. And are there a lot of pet injuries out there that...
Definitely, and in no way are we trying to take away from the vets. That's our first thing that we say. We want to be first responders. We want to make sure that we can get the pets stabilized, get them cared for, and then off to the vets. And that's our main focus. And there's tons of incidents that we can look after.
If I get hurt, we call an ambulance and off we go. What do we do if a dog gets hurt?
Well, that's where we come in. We're the first responders. We don't have a 911 that we can actually call. We talk about it in our course that, yes, definitely you can call ahead to the emergency vet, let them know what's happening and take them in, but we become the caregiver, the ambulance driver, and ultimately the pet owner in the end.
So we've had a little bit of background on the Walks and Wags program. Let's talk about the process that you went through to become a certified pet first aid trainer.
Sure, not a problem. With myself, as I said, I've always been involved in animals. I've worked for veterinarians in the past and learned quite a bit and volunteered at rescues, whether it was cat or dog rescues in the area. And when I decided to take the course, I took the course as a participant, enjoyed it so much that I actually contacted Lisa and said, if you ever have an opening in Calgary, would love to become an instructor. And thought, maybe I'll hear from her. And when she contacted, it's actually a heavy-duty reference check. They go through, they check your past, they make sure that you know how to work with animals and you actually know how to teach. So it's been a great process.
And how long was the certification process?
For myself, when you became it, for the instructor, you're actually studying pretty much the same manual. You have to actually have, I believe it was 90% at the time to pass your test to be able to even considered as an instructor.
Awesome.
And then Lisa conducts an instructor course depending on the area, because we don't want to oversaturate either and have too many instructors out there that don't know what they're doing. So she makes sure that there's enough per area, and usually she comes in for a few days and makes sure that she walks you through, and you have to go through a co-teach. You either have to have a vet tech or another teacher actually sit in and make sure that you're actually conducting the course properly as well.
So because there's no, it's not a regulated business,
Correct.
so
Correct.
it's industry certified.
Definitely.
And so they've done a really good job at getting the credentials and getting the legitimate medical care behind it.
Our texts that go out are actually looked at by vets. It's constantly re-looked at. That's why we only certify for 3 years, because we want to go back through that textbook. We want to make sure that we're using the right information from the vets. And we're actually recognized now by the Training Association in Canada, where we can actually put credits towards trainers for taking the course.
See, that's great.
Yeah.
Now, that's your certification as a trainer. You train and you teach a 10-hour pet first aid program.
Yes.
And that covers, just run through that quickly
We cover
for us.
everything from day-to-day care, because some people that come into it, whether they're pet owners, they're just lovers, they're thinking about getting a cat and dog, doggy daycare workers or dog walkers. Some people come in, they have no idea exactly what to do. So we talk about your relationship with your vet, the day-to-day care, how to watch it, from poisons, burns, treatments of bandaging wounds and splinting breaks, how to look after that, right up to the big things of choking, artificial respiration, CPR. And we look at even the onset of some diseases, because some of the symptoms and some of the diseases are so familiar. Once you take it, you get a lot of the light bulb moments where people go, that's why my vet was asking me those questions.
Right. And a lot of just the basic things like what to do when everybody's standing around screaming.
Exactly.
And who to phone. And
exactly. We want to make sure that everyone's prepared out there.
Good. Okay, well, we're going to take a quick break. And when we come back, we're going to talk a little bit about some of those elements that you teach in the class. We're going to get, and I'm so sorry, we haven't even introduced Tiki yet. Tiki, hello. Tiki is your...
Tiki is my pet. We've actually had her for about 5 years. She came to us through a local rescue, and very lucky to have her. So I always say that she's my middle child, she's my best friend, and she's also my business partner.
And because she is our victim today. She is going to have trauma. She's going to have splints. And she's been through it all before.
She's used to it. Yeah.
So
exactly.
All right. Okay. Well, we'll be back in just a minute. I'm Robert Church, and this is Critter Care on Shaw. Welcome back to Critter Care. I'm pet guy Robert Church. Thank you for joining us today. Very important program. We're talking about pet first aid, and Krista DeCarl joins us. She is a certified pet first aid instructor with Walks and Wags Pet First Aid. How many times did I just say pet first? I just said it again. So, shock, trauma, choking,
yes.
all things that could describe my performance, but also fit in with pet first aid. Tiki is here to help us.
Yes.
And what are the most common situations that we're going to find ourselves where we require pet first aid?
Well, some of them, of course, are going to be burns. A lot of people don't recognize that there's going to be burns, but nowadays when we have the glass top countertops for the stoves, you get a lot of cats that walk across, so you can get burns to the paws. When you start getting into closer to Christmas, people burning candles, you get cats, of course, that lean in. And even with the dogs, you start getting chemical burns where they're actually out in the garage when you get the fertilizers and you get the antifreezes and everything as well. Some of the other ones too are cuts. If they're playing around, sometimes they can get a bite. So you'll get actual lacerations in the ears, the tail.
Are you seeing more, do we see more injuries like in the home? Or out? I always think, oh, dogs are getting hit by all this stuff you just said. I never ever even thought of. I'm always thinking dog got hit by a car,
no.
you know, the dog fight at the park, things like that. But it all happens at the house.
Definitely. I would say usually they say about 85 to 90% of the accidents happen at home. Same thing for our pets. And it's just the way that we do it. A lot of it's human error. And it's not because we're being negligent, it's just because it's accidents that happen. Of course, we get the dog parks, and that's the big ones that you always hear about.
Sure.
The dog fights, the attacks, those kind of things. But a lot of things happen at home that we wouldn't even suspect.
The media seldom covers when a cat walks across the stove and burns its paw. That
yeah, exactly.
If there's a dog fight and people are involved, sure, that's a whole different ball of wax, isn't it?
Is that definitely?
So let's talk about the emergency situation where people like me are going to panic and not know what to do, because even if they do know what to do, they forget because everything goes out the window. You've got sort of a basic steps program.
Definitely. We always tell people, when you're at home and you're thinking about a fire, you always have that emergency backup plan. Do the same thing for your pets. Have that emergency action plan. We always say the first thing that you want to look at is, are you safe? You know, for an example, if there was a dog fight that was going on, are you safe to actually treat your animal after? If not, you may have to remove them, and that may be restraining your animal, moving them to a safe spot, or getting yourself to a safe spot. If yes, they are safe, then great, then you can actually look at your animal. Think through the situation. You know, you want to make sure, are they responsive? Are they actually looking at you when you call their name? If not, then you're going to have to look at some other issues, like I said, that we teach in the course. You know, are they breathing? Is their heart going? You know, you have to look at that. If they are responsive, there could be major cuts or minor cuts or breaks or bones. So you're going to have to look at that. It's making sure that you take the whole situation. I tell a lot of the students in the class, after you leave, go into a situation, go to the dog park and start thinking to yourself, what if? What if this was to happen? How would I react? Right. You know, always think about it. I caught myself for the longest time walking out the door going, okay, well, what if the dog across the street that always barks all of a sudden got out and attacked the dog? Start thinking about those situations, because we prepare ourselves for the human ones, prepare yourself for the pet ones.
Of course. And the other thing that's important is protecting ourselves in situations like that, because the most docile animal, if it's in pain, if it's hurt, if it's frightened, it can bite, it can be quite a bit more dangerous.
Definitely. We always say in pet first aid there's two major differences. One, when a human gets hurt, they can tell you what's hurt. These guys can't always tell you. And the second one is, humans usually don't bite. These guys do. I love Tiki, and she's been with me for a long time, but in a situation like that, I wouldn't trust her. And that's because they go back to their instinct. They want to make sure that they're safe over you.
Right. And, you know, and this is so funny, and I don't know why, but I never think about cats. You know, and I always think, oh, it's dogs that are getting in trouble and getting their head stuck, and you know, and cats, I'm sure, are always just getting into trouble.
You think about even at home when you're cooking or anything, if you have a cat, they're under your feet. So if you drop a knife or a fork or anything like that, you can get an impalement, something like that. Or some of the sweet smells that are out in the garage, you get the antifreeze. And unfortunately, we live in a day and age where some people don't like animals, and they set things out for them. And they can have to deal with poisons and everything as well. But it's recognizing, as cats get older, it's recognizing if it's diabetes or it's kidney disease. It's knowing those factors, so then that way you can save them some pain and hopefully give them a longer life.
And, you know, the course that you teach is 10 hours long.
10 hours.
And, I mean, we can't even touch the surface. All we can really do is sort of talk about the things that you need to talk about while you're there, and drill that into people's heads.
Definitely.
We can't, I mean, for liability reasons, we can't talk about CPR or the Heimlich maneuver or artificial respiration. I understand that. But it is really important that people learn how to do it properly.
Definitely, and that's one of the main things, one of the reasons that we don't talk about it is, in class we spend a lot of time, because it's different size animals. So you do compressions a little bit differently to a smaller animal than you do to a bigger animal. Same with breathing. I have CPR dogs and cats that we practice on, and there's many times that I'll get them to switch and people will forget exactly how to do it. So I pay a lot of attention to making sure that's one of the major parts of it. And I tell all my students, and any of my students can vouch for it, I don't let them leave unless they know exactly how to do it. I want them to come there, get what they wanted out of the course, and be able to leave and feel good about it.
And please never do the Heimlich maneuver on a dog. You told me that earlier.
Well, the CPR, the Heimlich maneuver, yes, because of course that's for the choking, you can do it, but you have to be very careful on the placement, because a lot of people get too close to the heart. CPR definitely, because I'll see people in the class, as soon as I start talking about the CPR, start lining up their hands on the dog just to see. You could stop a heart. by doing that.
Okay. So take the course
Yes.
before we start doing any of these, because these are medical procedures that are very effective, but they need to be done properly.
Exactly.
Something we can do at home, though, is have a proper pet first aid kit. And you've got an awesome one there. So I hope we can just take a couple minutes and look through it.
Definitely.
Nice, bright orange, visible.
Well, and I like it.
Reflective.
We always tell people it's great to have a pet first aid kit at home and then also in your car, because a lot of times we just grab these guys and we go for a walk, and then we'll leave it in our car. Well, if you have the cats at home, you want to be able to have it there as well. But with our pet first aid, what I love about this one is it has the different compartments, but right first thing when you open it, it actually has the 24-hour emergency and your regular vet. Write it down there, because if you don't have it programmed in your smartphones, people forget. You always hear the joke about people saying, call 911, what's the number? Exact same thing. You completely forget, so this is a nice reminder for it. It covers everything. We have bandages, we have the swabs, we have the scissors, and this is for a quick one. We have some of the antibiotics in there. We have tweezers, and one of my favorite ones is the shock blanket that we actually have.
I wanted to talk a little bit about shock. Maybe we'll do that after we come back. But the shock blanket is for just keeping them warm.
Definitely.
Correct?
And we always tell people that when there's a traumatic incident, and we'll talk about it during shock, you do need something like that to help out. And my favorite part in this is, too, it has the quick guide, because no matter what you do in your course, you can get 100%. Sometimes it's nice to have that quick guide to remind you.
Well, and it's great. I mean, look, it's got pet first aid manual. It's got everything, just really quick, easy reference so that you can work your way through it, and bing, bang, boom. Let's save some lives with this thing.
Definitely.
So, Krista DeCarl, we're getting some good work done here today. Walks and Wags Pet First Aid is the name of the program. And so what is the name of the website? walksandwags.com?
You can actually go to walksandwags.com, and it'll have a list of all our courses, and like I said, across Canada, and when the dates are, and you can actually register through there.
Okay, awesome. We'll be back in just a minute. I'm Robert Church. This is Critter Care on Shaw.
This is Shaw TV.
Welcome back to Critter Care. I'm pet guy Robert Church. Thank you so much for joining us today. We've got Krista DeCarl with us. She is a certified instructor with Walks and Wags Pet First Aid. And during the break, something horrible has happened to Tiki, the dog. She's bleeding heavily. I'm just about to run screaming. Fortunately, Krista's here. Krista, what do we do with a bleeding wound or injury?
Well, let me show you. First, stay calm, because as we know, our pets read off us. So if you get excited or anxious, they get anxious.
Okay.
So you want to make sure that you talk to your pet and keep them calm as you can. And then one of the #1 things too is don't try to work on a fighting animal. If your animal's struggling against you, just get them to the vet. You know, you don't want to waste any time.
Sure.
But if you're able to restrain them, and as I mentioned, you learn how to restrain them because you never know how an animal acts. But we're going to say that Tiki is restrained and she has an ear injury. You get lots of ear injuries from even when dogs are playing. Sometimes they bite and their teeth can go right through it because it's a thin skin.
That's a serious irritation. Sorry, I didn't say that out loud. So what are we gonna do? She's bleeding horribly from the ear.
We're going to bandage her ear, so we're going to make sure that we can get her to the vet and get her stabilized.
I'm not comfortable with this, but good luck. Good luck, Krista. You're the expert. Tiki, it's okay. I'll stay here and help calm you. So what do we do?
So if you have gauze squares, they're great. You can actually put it on the insert of the dog's ear, depending where the wound is. And then I put it on the backside. As I said, a lot of times when they get bit, it'll go right through. So this will actually hold it. When you're wrapping, everyone says always go with the natural fold because then it's a little bit more comfortable and you don't get a lot of blood also into their ear canal. Even if you have the longer ear beagles and that, you can actually wrap it and you'll wrap it around.
Do you wrap it just around the ear? I'll let you.
Yeah, no problem.
You go.
So when you first start, I like to start like this so you can actually show it. And you go around, and you'll notice when I'm going around, I'm not actually going by her throat because we don't want to become a choking victim and we're actually choking. So the other ear, what you're going to do is I come up and I cover. You use this as an anchor. That way it doesn't slide back or forward. You can see that it's going under her chin.
That's awesome. Tiki, are you okay?
I'm covering her wound.
Okay, she can still hear me though. She can hear my words of reassurance.
And Tiki's fantastic for this because we always say, try to wrap up closer to the eyebrows. And so she has the nice ruddy eyebrows that are up there.
Yeah.
And the reason that you do that is when you start to get really the smooth-haired dogs like the Labs, they can put their head up and it'll start to actually fold back.
And now, I don't want to take a page out of Ethne Dickinson's book.
Yes.
But if you don't have a big roll of gauze at the off-leash park, you can whip off one of your nylons.
You betcha.
Slice it off and wrap it around, and
you betcha.
You can also use it as a fan belt, I guess. But look at that. That is an awesome repair job.
And we still use that from Ethne because we say if you have a dog like this and they start to claw at it, put the nylon over their head and actually hold it in place.
Sure.
So with Tiki, you can see still about a finger's length, so it's not too tight for her.
Yeah.
She can still breathe, but there she is.
Okay. Well, that is now I'm a little worried because I think Tiki might be going into shock.
Well, with Tiki, shock can happen for many reasons. One of the reasons, of course, is a very traumatic experience. It doesn't always have to be physical, though. It can actually be emotional, that they can have it, heavy abuse, or if a large dog has attacked a small dog, sometimes it's psychological for the dogs.
It just freaks them out
It's
so
too
bad.
much for them. It's too much for them. Yeah. So they can go into shock like that as well. It can be from a vehicle accident. It can be from drowning. Sometimes it can be from heart failure, and sometimes from poisoning.
So we've all heard of shock, but I mean, physiologically,
yes.
What is it? They just shut down?
What shock is your body actually circulates blood to keep all the healthy tissues, the lungs, the heart, everything going. And what happens is it stops. So what happens is your body's not circulating enough blood to keep those going. So your body will slowly start to shut down. It'll start to, the organs will shut down, and eventually unconsciousness, and eventually artificial respiration will be needed because their heart will stop.
This isn't good.
No, it's not. So
how do we treat Tiki before she goes into shock then?
So with shock, as we showed in the Pet First Aid kit, you can actually use the shock blanket. You're going to stay calm the whole time. You're going to get them into the vehicle. You're going to call ahead. I always say, tell the vet that you're coming in. Do not give them any food or water, because if you don't know exactly what caused it and it's poisoning and you're giving food and water, you can actually be damaging them even further.
Okay, so just really for shock, keep them warm.
Keep
them
them warm.
To a vet.
Exactly, because they're going to be able to look after them there and go from there, because there's certain diseases towards the end, if they've had a lot of vomiting, diarrhea, they're losing all their liquids, they can go into it. And heavy burns can also cause that too. Okay,
so and if you don't have the NASA-approved first aid polymer aluminum blanket.
Use a blanket, use a jacket, use
anything.
anything.
Jacket.
Make sure that the car's warm when you're going, so then that way, you know, you don't want to overheat them if it's 30 degrees and turn it up, but you want to keep them warm. Because if you ever have seen when you're watching Titanic and you see them get really cold when they have the hypothermia and all of a sudden they're getting the shivers and everything, and then their body's shut down, shock can do similar things where the body starts to shut down, and these guys can get really cold, and it's because everything's starting to conserve heat.
Okay. Well, that was a really long movie, Titanic, but that was a part that I remember was when everybody started shutting down.
One of Tiki's favorites.
And my bark will go on. Okay, Tiki. Well, listen, we've gotten you through your shock of getting your ear bit up like that, and so I think maybe what we should do now is take a break.
Definitely sounds
Krista
good.
DeCarl, Walks and Wags Pet First Aid. And it's, I'm sorry, what's the website again?
It's www.walksandwags.com.
Okay, walksandwags.com. That's an easy one. Back in just a minute. I'm Robert Church. This is Critter Care on Shaw. Welcome back to Critter Care. I'm Pet Guy Robert Church. We've got Krista DeCarl with us. She is a certified pet first aid instructor with Walks and Wags Pet First Aid. So what she does is she teaches pet first aid to people. You can come, you can take one of the courses. It's walksandwags.com.
Definitely.
And boy, oh boy, you learn all CPR, artificial respiration, you learn the Heimlich maneuver, all kinds of really, really important information. So it's a great program to go through. And boy, oh boy, you save a dog's life. That's why firemen are always so, you know, oh, look, I saved a kitty. And everybody just, I mean, that's not why my wife loves firemen, but it certainly doesn't hurt that, you know, they're putting a little air mask on them and it comes back to life. I mean, anyways.
It's great.
Sorry.
No, it's great. I've had students actually contact me because of the course, and it's actually saved their pet's life.
Sure.
And You know, it's like having my own children. You know, I get the big smile on because I know I actually made a difference.
Well, of course, and our pets are so important to us that to be able to help them in an emergency situation is crucial. And poor Tiki here has had such a rough go of it
had a very rough
today.
day.
I mean, she's got the ear contusion. And now we've gotten her back from being in shock.
Yes.
But now we need to be talking about broken bones and joint injuries and soft tissue injuries. And how do we assess things like this in Tiki and other unfortunate pets?
Definitely. In the class, we actually talk about that, the difference between a fracture and a strain and a sprain and dislocation. And I always ask the class, how do you guys know the difference? And usually it's very quiet and silence, and I say, that's right, you don't know. You haven't gone to vet school, you don't have an x-ray machine, you can't tell. You can only assume that it's a fracture. And whether it's easy to tell if it's compound fracture, where the bone actually comes out of the skin, but we don't know. Yes, exactly. Nothing that you want to deal with on a regular basis, but you don't know. You have to treat it as a fracture and actually look after it that way and treat them gently. Because if you have a broken bone or if you ever had one in your life and someone came up to you and started grabbing it or pushing around, it's not the most lovable thing to do.
You said during the break too that you're seeing a lot more sort of sports-related injuries in these dogs.
Definitely. You see people, they're running all the time, so you start to hear about how their dogs actually have stress fractures. They're running. We socialize them. We always have them at the dog parks and on the weekends, and then we have them at the doggy daycares during the week. They're very active animals. And not everyone looks at their breeds. A lot of times you'll see people running out with a very small dog. Chihuahuas aren't meant to run that marathon. You know, you want to know your breed, and even if they're crossbreeds, and know how to treat them.
And dogs are so tenacious. They don't want to say, you know what, I can't do this.
Oh, no.
They're not going to say that. They're going to say, you know what, I'm going to run with you, and I'm going to keep up. And,
you betcha.
And that's when I hurt myself.
Yep.
And that's when the dog hurts himself.
Definitely. Tiki has a medical condition where she has a little bit of a breathing issue, but she would walk for miles and hours if I was to go.
A couple of quick things I want to get to before we go. We've got an injured dog. We've got them stabilized. Maybe they're warm. Maybe they're conscious. Maybe they're not. How do we safely transport an animal to the veterinarian?
Well, we always say, you know, it's great to have 3 people because then there's 2 people in case anything happens to the dog and they're looking after and the 3rd person's driving. But if it's just yourself, it's just getting them safely into the van or your vehicle, your car, whatever it is you're driving. We don't have those emergency life boards that you see. You can buy them if you're doing outback country camping or anything, but it's just picking them up as delicately as possible, putting them in your vehicle and getting them. If they're not conscious and they're too big to actually transport them, ask someone. There's always people around those dog parks that can actually help you out.
Okay, so we're not worried about the neck injuries and stuff. I mean, we just can't do anything about it, right? We have to get them to the vet.
That's exactly it. You know, we want to make sure that they're stabilized. We're holding them carefully, but we don't want to leave them there either. I
always wondered if you should, like, if you had a blanket, wrap them in a blanket, and that will immobilize them a little bit.
You can use it as a sling. You can actually get them out. If you have a moment, I can actually show you how to pick up a dog.
Oh, sure. Tiki, are you okay?
Yeah, come here, honey. With some of the bigger dogs, even with Tiki, I always tell people, with these guys, you can still pick them up yourself. And one of the best ways to do it...
Tiki looks like she should be a bigger dog, but she's actually not.
She's not that big.
She's an optical illusion a bit.
I always tell people, go down on one knee, have one knee up, so then that way it gives you a little bit of sense of stability. Put your hand underneath their bottom, and then one underneath the barrel of their chest. So then that way you can actually lift them, and you can actually pick them up like this and stand up and actually carry them. With the smaller dogs and cats, you can actually wrap them in a towel, like you said, and transport them that way. With the bigger guys, it's just getting them out as safely as possible.
I would be, I guess and nice if you can carry a kennel in your vehicle with you.
I
guess my thought is getting a cat that's sort of semi-injured to the vet and having it go wacky is just terrifying in a way.
Exactly, and don't be afraid of the towel. We say, you know, you can towel them, actually get them in there. You know, there's always jokes about transporting dogs compared to cats and how they're a little bit more feisty when they want to be, and it's getting them in that kennel and actually getting them in there so you can.
Right. Well, you know, we covered a lot of really good information today. We got a lot of good work done, and I really appreciate it. Krista DeCarl from Walks and Wags Pet First Aid. If you have any interest at all in learning pet first aid, walksandwags.com. You can find out where you're not the only certified trainer.
No, like I said, there's instructors in Calgary, surrounding area, and across Canada.
Programs all across Alberta, and it's a very, very good program. And so if you want to get into it, thank you so much for joining us today. Tiki, you got it. You got your.
She's free.
You're free. You're all better. Fantastic, Tiki. Thank you so much for helping as well, and thanks for watching, everybody. I hope you don't have an emergency, but if you do, maybe some of this helps, and I'm sure the course will help you too. Thanks for watching. I'm Robert Church. This has been Critter Care on Shaw.
We're there to bring it home. Shaw TV, your local voice.
The program you are about to see is produced by NUTV at the University of Calgary. The content of the program is the sole responsibility of the producer, and in no way represents the view of Shaw Cable System.
This week live on NUTV, we have Romanian pop star Anca Boiero in the studio. Then, we have Flow Martial Arts here to show you the art of stick fighting. Donovan Deschner's in the studio, and let me tell you, this dude is funny. Then after that, we are going to give you a premiere exclusive of our new cooking show, Bite Me. After that, we're giving away some Stamps tickets. So, ladies and gentlemen, Anca Boiero.